We're just a little bit over time, so I'm going to just have a couple of quick questions. There's two in the chat in particular. Both of those are probably for you, Zachary. There's one relating to topical estrogen and whether or not that can be used in conjunction with systemic HRT.
Yeah, that's a great question. It's certainly something that we discuss routinely. I think that certainly it could be more of a case-by-case basis. The vast majority of the topical estrogen is not absorbed systemically, so you're adding probably a marginal amount on top of the systemic HRT. Systemic HRT is used a lot less frequently here now, and so we don't run into that all that often. But I think ultimately it's plausible that the local effects of the vaginal estrogen might outweigh the risks of sort of a little bit more exposure. So, but I think it would be reasonable to, if the patient has very specific risk factors for bad outcomes like VTE or prior hormone receptor positive cancers or those types of things, to have sort of an individualized discussion with the clinicians. And then I see one about funding as well. So the wiki guidelines don't reimburse financially either their chairs, the leaders of the guidelines, or the participants in any way. Accessibility is important to the wiki guidelines group. So obviously open access journal fees are not cheap. And so that typically is also a crowdsourced type of initiative. So oftentimes we're able to cover those costs through grants or those types of things to make sure that our guidelines get published in an open access manner. But otherwise, the time is dedicated by the leaders and by the participants, and they aren't financially compensated in any way for their participation.
Great, thank you. And my question for Nico is, noting the IDSA guideline, very traditional approach to developing a clinical practice recommendation versus the wiki guidelines, how would you, as someone who has led one of these IDSA guidelines, make a decision about when you would use an IDSA developed guideline versus a wiki guideline? What sort of guidance can you provide for people about your framework for making those decisions?
So I guess I'm sort of uniquely suited to answer this because I was also part of the wiki guidelines. I was a panelist for the endocarditis wiki guidelines, and I really appreciate both approaches. You're not going to get me to say that you should use the IDSA guideline over the other. I really kind of object to eminence-based medicine. Very much agree with Dr. McDonald, and so I would say that we should be making decisions for our patients based on our read of the literature and what arguments we find most compelling. And I don't think it necessarily matters whether it comes from the IDSA or wiki guidelines or any other kind of specific group. I think we should let the arguments and the evidence stand on their own merits.
Yeah, and I would just add real quickly that one thing that Barbara Trotner and I highlighted very specifically at IDWeek was that we agree on a lot of things, and that should be incredibly reassuring to the clinicians out there that the things that we do agree on through two different methodologies is something that we should have a great deal of confidence in.
Fantastic. Well, I'd like to thank you both for your presentations as well as Emily. That was wonderful. I'm sure that everyone that's online and who's present in the room here really enjoyed that information that you shared with us. And I'd just like everyone to just give a little bit of a round of applause. And with this, I'll conclude this seminar, and thank you all for joining us. This is the last of our seminars for 2025. Been another fantastic year. We have done some statistics recently on how successful this whole seminar program has been in recent years, and on YouTube we have over 80,000 views for our nearly 400 videos that we have present, and we have about a 90% satisfaction rate, so where people rate the content as good or excellent, and I think that we're going to get more of those favourable responses with the high quality of presentations that we had today as well. So thank you very much to Nico, Zachary, and Emily for volunteering their time and sharing their wisdom, and for everyone who's been able to join us online and in the room here. Have a wonderful evening, afternoon, morning, wherever you are. Thank you.